I'm basically streaming on both Instagram and YouTube both. So today basically there were a lot of questions regarding remedies in relation to rainy season and what viral fevers with fever, with headache and body ache, diarrhea, dysentery, a lot of questions we had. So I basically decided to tell you some remedies which is used frequently in these conditions. Now during in the past 5-10 days there are a lot of cases of fever with headache and body ache coming, and sometimes it becomes difficult because we cannot judge the whole picture of the case at the first instance. So how to prescribe the remedy, and the first of all, which remedy comes into our mind? The first remedy that should come to your mind basically in relation to this is such a common remedy, that is arsenic album. Hello, Dr. Weber, Dr. Anja, Dr. Kochar. Now, whenever you are prescribing arsenic album, 2 or 3 symptoms basically which I have seen are very, very important. That is, oh, Dr. Robbins, we have just started the session, so let us first continue. Swelling of the throat, constriction in the throat, unable to swallow. That is the first symptom basically which you should look for arsenic in these type of cases. Of course, elements from getting wet, we have Rustox, we have alum cepa, we have other drugs, but this is very important, that constriction of throat in arsenic album. Second, in arsenic album, it is very important to see the tongue. The tongue is dry, clean and red. That is arsenic album tongue. And the taste. The taste of arsenic album is metallic taste. Of course, this comes secondary. First, we have symptoms of hay fever. So, arsenic is the first remedy for hay fever with coryza, which is worst in the open air. The patient says, whenever I go out and there is a lot of wind and draft of air, I feel sneezing and the nose stopped up, and the patient feels better indoors. And the patient comes and tells you, however I sneeze, मैं जितनी भी छींक मारा तो however I sneeze and how many times I sneeze, it does not give me relief. This is a very, very important indication of arsenic album. With the nose is stopped up. बोलता है nose मेरा पूरा भरा हुआ है, जाम है, and the discharge is thin, watery and excoriating discharge. Now these are 4-5 symptoms of arsenic album in these type of condition, which are very, very important to know and understand with the weakness of arsenic. So what symptoms we have? Thin, watery, excoriating coryza, nose is stopped up, sneezing does not give relief, and aggravation in the open air, and the patient is better indoors. And as the stage progresses, there is swelling and constriction in the throat with difficult to swallow. These are the few very, very important indication of arsenic album that you should look in your patients in this condition, in viral conditions. Second remedy, which basically everybody must be waiting to hear, and that is rust toxicodendron. Whenever we are taught that the patient gets wet in the rain and the symptom starts, the most important remedy is Rustox. And Rustox is such sometimes widely used, sometimes abused also. Whenever we get a patient बारिश में भीगा, we start Rustox. So Dr. Palak, welcome. Dr. Meera, good afternoon. Dr. Meera, Dr. Borkar, good afternoon. Dr. Arora, good afternoon. Dr. Robbins, yeah. Dr. Madan. So whenever you are prescribing Rustox, very, very important symptoms of Rustox that you must remember. In Rustox, of course, elements from getting wet is very important, but in Rustox, the tip of the nose is red and sore. He'll say, sir, यहाँ बहुत दर्द कर रहा नाक में. There is swelling of the nose, and the most important symptom is there is lot of sneezing, similar to arsenic. There is lot of sneezing similar to arsenic. And when you open the throat of the Rustox patient, the patient says there is sticking pain on swallowing. There is sticking pain while swallowing and sore with swollen glands. The throat is sore and the glands are swollen. That is a very, very important indication of Rustox. I hope you can differentiate between Rustox and arsenic album, because both are very important. Furthermore, the patient comes and tells that my head feels very heavy. The patient says head feels very heavy and the brain feels loose. the brain feels loose as if stuck against the skull. जैसे patient उठता है सवेरे, he feels as if it is very loose on rising and walking. That's a very very important symptoms of Rustox. Yeah, I'll get some of the remedies also, Dr. Arora, but let me complete few remedies which are very very important that I have used in my practice. And the eye symptoms. There is the there is swollen eyes, and there is the lids are inflamed and agglutinated. Those are the symptoms of Rustox. Then of course you have the bony pains, and the patient feels as if the pain is so much as if the flesh is scraped away from the bones. Those are of course very very important symptoms of Rustox. That should be there, and that are there. But these symptoms of note and throat are very very important. Now one thing very peculiar to Rustox that you have to look in case of cough, that the patient says there's tickling behind the sternum. He'll say हिंदी में कि मुझे बहुत गुदगुदी लग रही है इसके पीछे. That is a typical symptom of Rustox, and the cough of Rustox is a dry cough, teasing cough from midnight to early morning. So don't always think about Rustox when midnight cough is there. From midnight to early morning अगर patient खांसते रहता है, that is Rustox. So these are symptoms, and Rustox has a typical symptoms like Euphorbia perfolitum, that is influenza with aching in the all bones. There is lot of pain in the bones, especially in cases of influenza. So these are the very very important indication of Rustox in relation to influenza. So whenever you come with Rustox, that bony pains are there, immediately one remedy that should come to your mind is Euphorbia perfolitum, and as it is called as break bone fever. Now if Rustox has heaviness of the head, Euphorbia perf has throbbing pain in the head. Throbbing pain. The pain is very throbbing, and whenever the word throbbing pain comes, automatically you start thinking about belladonna. So this is how you have to be very cautious in asking symptoms to the patient, and because one symptom leads to one remedy. So take some symptoms which are very very peculiar to the patient. So the patient of Euphorbia perf has throbbing pain in the head, and there is cracks in the corners of the mouth. Welcome, Hital Homeopathy. There is cracks in the corners of the mouth. That is again a very important symptom of Euphorbia perfolitum. As you go further, you find that the patient starts vomiting because the chills is coming in Euphorbia perfolitum. It is important. But coryza with sneezing, मतलब patient को सर्दी भी रहेंगी और छींके भी आएंगी. I told in arsenic the nose is stopped up. In Rustox there is pain and swelling in the tip of the nose. In Euphorbia perf there is coryza with sneezing, and influenza with great soreness of muscles and bones. See, it is so close to Rustox. But in Euphorbia perf, the cough is relieved by getting getting on hands and knees. That is again a symptom, a very very important symptom of Euphorbia perfolitum. And it is said that perspiration relieves all the symptom except headache. That is again a very very important symptom of Euphorbia perfolitum. So these again basically are symptoms of Euphorbia perfolitum in relation to these viral fevers. As you can see that there will be a lot of cases of viral fevers in your practice, and sometimes it becomes very difficult to differentiate, and sometimes we miss the remedies. Similar to arsenic but very close to arsenic but not arsenic, you must remember one remedy, that is China ars. China ars again. In China ars, a patient will come and tell you, ऐसी मेरा सर पूरा भरा हुआ लग रहा है. In Hindi, head feels as if it is too full. That's why there is a lot of throbbing and very irritability. That is a very important symptom of China ars. And in China there is intense photophobia. There is a lot of photophobia, and that's an important indication of China ars. There is a lot of weakness in the limbs. Weakness of the limbs again is a very very important symptom of China ars. And coldness of the hands and feet, knees and the limbs, feels absolutely cold. That's a very very important symptom of China ars in relation to extremities. And one more symptom of China ars that you should always remember is weakness. And the weakness is continuous from day one. However the patient is, how much the patient is, the weakness is almost continuous. That is the remedy China ars. I hope you could understand some China ars, arsenic album, Euphorbia perf, Rustox, very very close. And then you have remedies like belladonna, you have glonine, you have gelsemium. These are all other remedies basically that you should understand. First, let me take some questions because a lot of questions have been scrolled up. Good afternoon, Dr. Alam. Salam sir, tinea cruris की itching को control करने के लिए. See, I told you a lot of remedies like for tinea cruris, CPI is there, tellurium is there, echinacea is there, azathiotic indica is there, thuja is there, cilicia is there. Symptomatically very important, you know. Good afternoon, Dr. Singh. Dalkamara phone. Yeah, so I was going to Dalkamara, but okay, if you ask the question. Now, Dalkamara. See, whenever we say that dampness is there, rains have come, and there is a lot of dampness in the surface, the first remedy which we think about is Dalkamara. Now, Dalkamara, see, we have seen the head symptoms of Eupyterium perf, arsenic album, rustox, China. Now, Dalkamara has again a very important symptom of head symptoms. Headache is relieved by conversation, you know. Patient will come and tell you, I had a lot of headache, but some persons came to my home and there was work, so I was talking to them and I was feeling better in headache. This is a very typical Dalkamara headache. Headache is relieved by conversation. People say that there are symptoms of Dalkamara, catarrhal, rheumatism, inflammation, discharge, yellowish, cough comes out, lot of rattling. It is there, but headache is better by conversation. And in Dalkamara, the coryza is dry. नाक पूरा सूखा है फिर भी सर्दी है पेशेंट को. Because of that, there is complete stoppage of nose. There is complete stuffiness of nose. So we have Dr. Bhushan also online on Instagram. Sir, my mommy is there. So dry coryza, complete stoppage of the nose, And of course, if there is a discharge, you can also always have profuse coryza with yellowish mucus and crust. That's also there in Dalkamara, but I'm telling you other symptoms also. Dalkamara also is a very important remedy for hay fever when there's profuse water discharge, which is worse in the open air. See, so close to arsenic. Arsenic is also aggravation from open air and better indoors. Same hay fever with profuse watery discharge, worst in the open air, is also Dalkamara. I'll come to other symptoms also, but of the cough and all. But let me tell you some symptoms which are very, very important, of Dalkamara, and sometimes we miss out those symptoms just because we know the regular symptoms of that remedy. Now, the most important symptom that everybody wants to hear is the cough symptoms. Now, in Dalkamara, of course, there are a lot of symptoms, but it is said that winter coughs, which are very dry, is a very, very important indication of Dalkamara. And there is also loose and rattling cough, which is worst in the wet weather. So whenever the weather is wet, Dalkamara is again a very, very important remedy for that. So I told you both the parts in Dalkamara. The cough, the dryness of the nose, because of that stoppage of the nose is there. In some patients, you have profuse nose and profuse discharge from the nose with yellow crust formation. So don't always think about Dalkamara when there's a discharge which is very mucus and yellowish, but sometimes in dry nose also very close to aurum triphyllum, where there's a dry coryza with loss of discharge, that's also aurum triphyllum. Of course, then in Dalkamara, the patient coughs for a long time. बहुत खांसता है, it coughs for a long time, and then the expectoration of mucus or phlegm. And in Dalkamara, remember, cough after physical exertion. I think in my YouTube live, in my channel also I have told, cough from physical exertion is a very, very important symptom of Dalkamara. And of course, one symptom that everybody sees of Dalkamara is cough is worse in cold and wet weather. And there is expectoration is very free. मतलब खांसता है तो बलगम निकल जाता है. So these are the symptoms of Dalkamara. What one of the doctor was asking, some symptoms. Rustox, the tongue has red. Yeah, Rustox has definitely triangular red tip, but in acute coryza or hay fever, I have not seen that type of tongue. So I'm just telling you some clinical applications of the remedy which I have seen in my practice. Of course, mathematica wise, there are other lot of symptoms of Dalkamara or Rustox, but I have told you those symptoms which I have seen in my practice. The rest is white coat. Yeah, cracks in the corner of mouth. Yeah, it can be because of B12 deficiency, and that's also there. Eupyterium has or does not perspire accompanying most complaints. No, in Eupyterium perf, I have not seen perspiration. I have not prescribed on that. Impetigo in 2 years old child, thick yellow crusts on chin Antim crude, no effect. Merc virus, discharge left eye, discharge went around mouth and dried bleeding child, scratches off at night. Now basically see if you have these type of complaints of impetigo, and in impetigo, see if you go to see, these symptoms basically are very common, that scratching, and the scratching will discharge the yellow pus and all. So these, if you prescribe more those symptoms on the disease symptom, you'll always land them in remedies like mercury or calcarea or causticum or petroleum. But try to prescribe on the patient as a person. For example, if you have seen causticum also, I have got very good results with causticum. And the symptom similarity of causticum is again very important. Now causticum, if you see mater medica, causticum has lot of symptoms of impetigo. For example, if you open mater medica and see causticum, there is a lot of pain in the scalp, there is a lot of discharge from the scalp, there is crust formation also, and there is the discharge is also offensive. Aurum trifarum also has a very interesting indication of impetigo. What symptoms you have written, that discharge is there, it sticks up. Of course, mercury is one of the most used remedy in impetigo, but do think about causticum, calcarea carp, and aurum trifilum. Aurum trifilum, aurum trifilum is again a remedy which is sometimes not used as it has to be used, especially in coryza. If you see aurum trifilum coryza, there is acridity of discharge, acridity of discharge. And the nostrils of aurum trifilum become very raw. The patient cannot touch the nostril because of the acridity discharge. That's the indication of aurum trifilum. Okay. Dulcamara, okay. I hope you got some inputs with that. Dry, coryza, or perfume, both are there in Dulcamara. A case of brain hemorrhage, she had severe headache with continuous vomiting, operation done, but now she is in coma. This case I posted in WhatsApp, please suggest. Okay. Now see, if the patient is done if the patient has already had hemorrhage and operated and now is in coma. So see, there are a lot of other causes for patient going in coma. Either in the MRI scan, is there a midline shift, or there is coning, or there was problem with the anesthesia. So there are a lot of causes for the patient going in coma. So if you could get me more history of the patient, we'll be able to prescribe more, Otherwise, the remedies for this type, we can think of arnica, you can think of calcarea carp, we can think of crotalus, any snake poison now is very common. But some defining features, why did the patient go in coma, that's also very important, what is the cause? That's important. You get these symptoms, and then we can help you. Child is calcarea carp constitution for impetigo but has not helped. Okay. So whatever I told, I have only treated the impetigo, calcarea, and 30. Perhaps I should go higher. Yeah. No, I would suggest if the calcarea carp constitution is there. So if calcarea carp you feel 30 is not, you can always try 200. But if you are very sure that's a calcarea carp constitution, that means it is very close to calcarea but not calcarea. So you must think in these cases, whatever my experience there, think about calcarea sulf. It covers all the symptoms you have written: the crust formation, the pus discharge, the itching, the acridity, and the unhealthy skin, and the tendency to eruptions and abscess is also covered in calcarea sulf. So first give calcarea carp. If it does not work, try calcarea sulf. Okay. A patient obstruction of nose, especially at night, alternates the lying on sides. Open air better, cold air aggravation, vomiting desires. Now see, whenever you are treating a case of obstruction, and of course, and the patient continuously keeps telling you that when he was lying on side, alternating on sides, the complaints aggravate. Now, whenever I am treating a case, there are few remedies which are very important, Dr. Madan. For this, you must think about 3-4 remedies that has been used with good results. Laccan, phosphorus, gelsemium, Nux vomica, and calibichrome. These are the remedies which I have used and have got fairly good results with these type of complaints. So you can think about one of these remedies, or you have cases where the patient comes and tells you that I have obstruction of nose, alternating with discharges. Means he says that Nagpur the nose is closed, obstructed, sometimes open with discharge, and again becomes obstructed. These symptoms are very common in case of, because you can't have obstruction the whole night or the whole day. It's most of all alternating. So if it is alternating with discharge, then you must think about silicia, arsenic, belladonna, and atramure. These so define and try to ask some symptoms from the patient, and then if it is alternating with obstruction, then think about these 4 remedies which I have told you. Yeah, okay, I hope you got the answers. So this was basically some indications of some remedies which I have used in my practice, for a while. Now, do we have some questions, or I can go forward? Thanks. Okay. So one more remedy that basically comes to my mind, which is again a remedy where there is lot of weakness, and sometimes we confuse this remedy with arsenic or China horse, and that remedy which I'm talking about. Can you repeat the remedies? The alternating one, that silicia, belladonna. If it is alternating with discharge, yeah. So if the patient comes and tells you that if it is alternating with discharge, then it is silicia, arsenic, natramure, and belladonna. Alternating with discharges. 45 years patient, total lack of loss of sexual desire. Yeah, Dr. Singh, now see, there are a lot of remedies where you can prescribe these cases, but whenever the patient comes and tells you that he has lost sexual desire, do ask him why. See, there are a lot of causes for loss of sexual desire. Of course, primary cause, if the patient is having diabetes or blood pressure, it can have a problem. But then mentally also, it is very important to understand the stress the patient is going through, and the whole energy of the body is so much absorbed in that stress that he loses the desire. So for me, if you ask these cases, people might tell you they use remedies like lycopodium or avanacetab or acid phosphocylinium or yoimbinum, but just ask the patient why. If you ask the patient why and we get few more symptoms in the history, we'll be able to tell you better answers. Liver cancer, wow, it's a very good case, Dr. Vinugopal. If you could share the case whole on the WhatsApp, or now we will be able to help you, because these cases basically, you, as I always say, that you have to be lucky to get these type of cases in your practice, and then more lucky to take the whole history and be able to cure these cases, because these cases, if you give relief to the patients, in case of liver cancer, of course, it is very good for the patients, but it is good for your confidence also, that you can grow in your practice. So take the whole case and then we can discuss the case. Graphitis, mother tincture, just 2 space. Nephilim, mother tincture, just 2 doses, spaced many hours apart, and single pill of Nephilim 30 induced increase in pain, tickling, and cramp symptoms of sciatica, and decided not to take homeopathic medicines. Okay, you can explain the patient, that it does not happen, or you have to counsel the patient, and automatically she'll come to you. So sometimes it happens that the remedy does not work, or it may be a coincidence that you have given Nephilim, and it is not because of Nephilim that the patient has increased. It was basically a coincidence that something happened. The patient had bent down or lifted heavy weight, and it's a coincidence that it has reacted so much. You have to counsel the patient and then start the treatment. Good afternoon, sir. Dr. Vishal. Yeah, good afternoon, Dr. Vishal. Head injury, remedy selection on changes of brain or physical, mental symptoms, how to select. Yeah, in case of head injury, basically, when the patient comes with head injury, he is in dire straits. Of course, do take symptoms what happened just before injury. If you can get that symptom, then it's very good. Otherwise, try to prescribe on the defining symptom of the head injury, whether head injury the patient is in coma or speaking, or where is the clot, it is big, it is small, it is which side, left side, right side, there is bleeding from the nose. There are other symptoms that you should look about, and if possible, just ask the patient or just ask the relatives what was the thought process just before the accident or just before the injury, and then also you can be able to prescribe. Dr. Bhatt is there on Instagram, welcome. Yeah, so Dr. Arora has cervical Nabothian cyst, endometrial hyperplasia and uterus, giving Ustilago Q. No, don't give Ustilago Q. Basically you are treating a case of endometrial hyperplasia. Hyperplasia means hyper, more. So it is basically a syphilitic state. So mother tinctures I don't know Ustelago will help or not. I have never used Ustelago for this condition, but hyperplasia means there is a syphilitic symptom in the patient. So do take a case taking and prescribe on some syphilitic features. Single dose should help you. Ustelago in mother tincture, lot of doctors use. So I have not used Ustelago, so I cannot answer. But for me, it's hyperplasia, syphilitic miasm. So try to take some syphilitic symptoms from the patient's case taking. Is this homeopathy aggravation or idiosyncratic reaction? No, it is not homeopathy aggravation, because nephylim, if you have only prescribed on the organic features. So I have never seen homeopathic aggravation in these cases. Idiosyncrasy is not seen. I have never seen in nephylim. It's maybe a coincidence that the patient has done something to cause strain over that part, and that has caused pressure symptoms on that area, and that's why the symptoms have started. Patient suffering migraine left-sided. So Dr. Singh, you're telling me the same patient who is suffering from, see Dr. Arora, we have Fraxinus americans, we have Ficus religiosa, we have Thalaspi bursa pastoris, we have Trillium pendulum, lot of remedies, but Fraxinus americans basically a lot of people or doctors use for fibroids, but for hyperplasia, I would still suggest you to prescribe on the symptomatology. Of course, if you want, if you are very comfortable and you are mentally satisfied by using a mother tincture, you can use that. But basically, try to get that syphilis symptom from case taking. Yeah, so migraine patient, left-sided headache, stress of the family. So basically, you have to understand which type of stress and why the stress has led to this. Sometimes what happens that you are elder in the family, so you have to understand and you have to take everybody into account, and सबको हमको झेलना पड़ता है, सबको साथ में लेके चलना पड़ता है at our own risk. So Dr. Singh, if you have cases, what symptoms you have, left-sided migraine because of stress in the family, one remedy that is very close that you should think about, or 2 or 3 remedies that comes to my mind. First is selenium, second is phosphorus, third is argentum nitricum. So you can select in one of these 3 remedies, which normally whatever I can repertorize in my mind, these 3 remedies come to my mind: selenium, phosphorus, and argentum nitricum. All 3 are left-sided, all 3 have stress, all 3 have the same symptom what you have told me. Patients who suffer from loss of taste even after many months for even a year. Yeah, so see, if there is loss of taste, ask the patient which type of why is there is lot of loss of taste. Because if you nowadays there are the use of repertory so much that you type just one thing and you have so many remedies. Now loss of taste, you can have remedies like phosphorus or silicia or natramur, pulsatilla, sulfur, viriatrum. Sometimes the patient says that he cannot taste food. So there's loss of taste and the tastelessness of food. Then you have to see which type of food. For example, the patient says, I taste the beer tastes like this, the bread tastes like this, or whenever I have coryza cough, the taste is changed. These are the symptoms that you have to, as always, of COVID. So loss of taste from COVID. So in this case, if it has been long time and the patient has told you the history, do give the COVID-19 nosode to that patient. I welcome Dr. Hital. Okay, she's there. Barwala. In Instagram, she's there. So you can start with a nosode COVID-19, which I have used in my practice with very good results. I want to share a case: mild cold, running nose, 7 days, all the sudden pressure symptom, unable to breathe, fever, blood saturation 91, carboxy 200, cured case overnight very good, very nice. So can you share that which symptoms did you took for classical symptom you took for the prescription, so we can also learn from you. Xanthosylum 30. Of course, see remedy wise in homeopathy, see if you see remedy wise, xanthosylum is used for a lot of condition, and I don't know for what context xanthosylum was. Yeah, you can WhatsApp me. I'll send the medicine to you if it is available. Because I've sent to hundreds and hundreds of doctors. I'll check it, but you can always, as I told you, I have sent a lot of COVID-19 vaccines to medicines to a lot of doctors. You can write your address, so I can send you that. Now if xanthozylum has come, so I will tell you something about xanthozylum. Uh, COVID notion I have made, so I have basically used that in my practice, so I can send you. You can send me your address. Now the word xanthozylum has come, so I'll tell you in xanthozylum I have used that remedy in lots cases of female complaints. When the menses are very early and painful. It is a very very interesting remedy when the menses are thick. How is the menses of xanthozylum? It is almost black in color. I remember a patient. The patient came and told me, "Okay, sir, my menses is like when from the machine the oil comes out in black type of oil. This is my menses." It was so black, and I prescribed the patient xanthozylum, and the patient did very well with that. And one more symptom, xanthozylum has leukorrhea at the time of menses. So whoever wants that COVID-19 nosodes, I have told before also, just send me your address on my on that WhatsApp group, and I can send you the nosode. Okay. I have told everything, doctor. I don't know the name of the doctor 1, 2, 3, 4, 5. I have told you, I had used that. Remedy COVID-19 twice a day for 3 days in case of active infection, and as a preventive twice a day for 1 day in case of prophylactic. Fever in Dr. Vishaka is there on Instagram. Yeah, welcome. So we just a minute. Chicken fever, monsoon fever. I have told the remedies, Dr. Prashant. No, arsenic alb I told. I think muriatic acid I have told. Upoterum puff, Rustox, arsenic. Of course, ferrum phos is there. Gelsemium is there. Belladonna is there. A lot of remedies, but I have discussed 400-500. But there were so many questions asked, so that I had to shift on the questions. Okay. Dr. Gupta says, yeah, Dr. Vishaka is Dr. Vishal. Okay, welcome, Dr. Vishal. On Instagram is there. So we have chikungunya, joint pains, arthritis lasts for long. Some old are crippled with disease. Yeah. So if you have, I don't know if you have heard me since 2 years, but I have told in these type of cases, go to the repertory and see in generalities and extremities, pain, inflammatory, because chikungunya was inflammatory pain, no? So after inflammation, the pain persists, go to that rubric. There are so many remedies, and then you can differentiate the type of pain or the personality and prescribe the remedy. A long distance female patient, 55 years, colon cancer, 3rd stage, doing chemo, a strong mental state, working woman, had profuse menses, and any mother tincture or colon cancer, I don't know, in colon cancer, I have used mother tincture. But whenever, Dr. Madan, if you could tell me at least one symptom, of how one symptom, so that it is very easy for me to tell you some remedies, because I have not used mother tinctures for cancer of colon, but still I would share some of the remedies, of the cancer of colon that you should think about. Kundorango, Carboanimalis, carbolic acid, phosphorus, arsenic. So these 5 remedies are there, but then these remedies have to be actually differentiated and then because see, you are treating a case of colon cancer, and colon cancer, I suppose, if you just prescribe these type of remedies, it will not indicate, because in colon cancer, one remedy, in fact, is very very important to understand. It is golden seal. That is, I think, Hydrastis canadensis. Nitric acid, Kalikap, especially if the colon is involved. So if you are only, if you basically want to give some mother tinctures, you can try Hydrastis, and if you get some good results, just share the results with us so that we also know that it's working. Because when I was I was attending seminars when I was very young, maybe 20 years back. So some doctors had told me use Hydrastis mother tincture, it gives good results. So if you if you have no symptoms and only you have to prescribe some remedy, you can think about Hydrastis canadensis. Mira, for high SGOT level, what's the approach for Mira? Yeah, Mira, she's there on Instagram also. Okay, so Mira, for high SGOT level means, first of all, tell the patient basically to avoid lots of oily food and lots of food which are difficult to digest. Bland food only if OTPT levels high, it will respond to treatment. Think some remedies which are, if it is only related to liver, for example, if there's pain in the liver or there is uneasiness, there is nausea, there is vomiting, some symptoms have to be there, to prescribe. So you can think about chelidonium, where the pain is in the inferior angle of the right scapula, or podophyllum, and the patient has to rub the liver, or cardusmar for pain. So there are a lot of remedies. If you can give me some symptoms, then you can cure that case. But just blend that for about 14 days to cure that case without medicines also. That's what I feel, because only OT level is increased. Of course, just check the patient is not suffering from some autoimmune disorders like Gilbert syndrome. In those cases, the OTPT levels are high for a long time. Post-operative coma. No, there is nothing as post-operative coma. Post-operative coma, that means something has went wrong in the operation, or the anesthesia is there, a problem in anesthesia, or some symptoms have to be there. We can't only prescribe for post-operative coma. If you feel that anesthesia is a problem, then you can think about acetic acid or phosphorus, depending on anesthesia. Okay. Sir, any remedy for mitral regurgitation? See, mitral regurgitation, if you only want the remedy, see, whenever there's a mitral valve involved and there's mitral disease, few remedies are very, very common and very, very important. The first remedy that you should think about is strophanthus. First remedy is strophanthus, and it's a very, very, if you have no symptoms, then you can think of strophanthus. Second remedy is, I think, snowdrop. And the common name is, I think, Galanthus niveatus, snowdrop. But strophanthus is a very, very important remedy, and it's basically indicated for mitral insufficient, mitral valve problem. Again, then there is a lot of remedies, like we have crataegus, we have laurocerasis, we have other remedies like medorinum also there. But these strophanthus or Galanthus, snowdrop are very, very important in these conditions. Bartholin's, I have a question on Instagram, so I'll be seeing on that. Bartholin says replaced even after operation. Size is not increasing now, but it is static. Yeah. So Bartholin says, Dr. Vishal, is a recurring disease, and the cyst is very painful, and sometimes it bursts open and the pus discharges there, especially because of infection, chronic infection, or because of physical trauma or physical activity. In this case, it might keep reoccurring, but if you prescribe a constitutional remedy, it will reoccur and go or disappear on its own. It will come once, twice, thrice. But if you give placebo also, the patient will get better. Still, if you feel that after constitutional medicine, still there is some pus discharging painful, you can think about remedies like calendula in LM potency, belladonna. It will relieve the pain, and the chronic remedy will cure that case, and the recurrence will be stopped. Sir, for vertigo with hypertension, atherosclerosis, aggression from moving from rest, looking upwards, can you say? Yeah. So very, very interesting symptom, and remedies also. Think about iodine, think about thiocyanaminium, and think about phosphorus. Yeah. So you have got the number for COVID no source. You can send your address. I'll send you the medicines. There is calcium deposition over the valve. If we can dissolve it. We can dissolve that. We can give COVID nosode to someone who had COVID. Yeah, you can give COVID nosode, but after COVID, if there are other symptoms, for example, after COVID, the patient has suddenly developed a lot of cholesterol, diabetes, or whatever symptom the patient develops, then you can give the medicine. No, if he has no symptom, then why to waste the remedy? Yeah. Strophanthus, you can know. There was this strophanthus is basic. There are two strophanthus. One is strophanthus H and one is strophanthus S. That is called strophanthus saramentos. You got that? Strophanthus. No pain, no symptom. So if there is no pain, no symptom, Dr. Vishal, then you have to basically take the whole case and prescribe the remedy. In Tritigo. Now, in Tritigo, just basically, if you just want the remedies for in Tritigo, there are so many remedies. All the remedies which have unhealthy skin, you can think about that in Tritigo. So sulfur is there, then calcareous sulfur is there, silicia is there, hepa sulfur is there, phosphorus is there. A lot of remedies are there. 8-year-old child has conspicuous fixation of the first index phalanx, is there a rubric? Yeah. So see, if there are some which have fixed ideas. So there is one rubric: delusion delirious. Delusion delirious. Uh, Dr. Nikhil Zodape, welcome. I think. So please throw some light upon how to dissolve calcium deposition over the... No, no. See, Dr. Kaur, I don't have a specific remedy for that. Of course, in this case, it is very important to take the whole case, and then we can prescribe. So it's important for me to get the whole case, because I don't have that. Of course, there are remedies where it is written that you can dissolve calcium, and especially when the calcium is deposited in the coronary arteries, and boric, it is written that it has a solvent power over the crustaceous and the calcareous deposits of the arteries. You have that, So, but there is no specific the specific for it. Fixed ideas, now you see, if there is basically a fixation, so that if at all, if the case comes to me, I would always see why there is a fixation, and delusion delirious, basically I've used where there's a lot of other fixation, because the remedies in those, if you see the delusion which are very delirious and fixed ideas, the remedies are all the trios is there. Belladonna is there, stramonium is there, hyoscyamus is there, sulfur is there, and cannabis sativa is there. So this is basically delusion. He has fixed ideas about something, and he's hell bent on understanding that this is right. So I take the rubric delusion delirious. So all the three, what we get, the panic remedies or the maniac remedies are there, and there are a lot of other remedies also. Yeah, see, basically, when your mind is fixed to something, that means you are not able to think beyond that. So we call that the mind is basically in a trance. That's why I use that rubric. But I would basically have that. See, delirious means what? Thinking or speaking of in a crazy way. The patient think that he's going crazy. That's why basically of becoming because of illness. He feels that way. This. So craziness is there. So that's I take the rubric delusion delirious. Yeah, finger. Seborrheic dermatitis. Okay, I have not seen that case because I was out and going to a lot of rush. I may not have seen the case. I'll discuss it when I see that. So somewhere it is mentioned spigelia as dissolved. Yeah, it is mentioned somewhere. I have not seen spigelia, but it is crataegus. But spigelia I have used, but I have not used that. I used to use before. If it works, work. If it does not work, does not work. But these remedies which have basically, like for instance, if you see Adonis vernalis, it contains all the symptoms of mitral valve and the fatty degeneration of the heart. But when you actually give the patient the response, sometimes they are not there. So basically, I am now that if you take the history, the body will heal itself. That's the concept now. So if the body will heal itself, you have to just give one stimulation to the body, wait for the body to work. So body will heal by itself. Yeah, finger. Any remedies of the combination which helps increase platelet count? No, combination I have not used, but I definitely use carica papaya in low potency, sometimes with the constitutional remedy, and it gives good results. Yeah, carica. It is it is very commonly used, carica papaya. So I think that's all. Or we have some more questions. Oh, it's already 45 minutes. Okay. Instagram questions. Some of the questions have been scrolled up, so I can't. In which potency? Low potency I give. I give 6 potency. Carica papaya. I have not given mother tincture, but 6 potency you can give with your medicine, constitutional medicine. But see, in basically what happens, role of pyrogenum. See, pyrogenum basically, if you basically want to prescribe pyrogenum, of course, first symptom of pyrogenum, anybody? Pyrogenum, pyrogenum is a remedy. Anybody can give some symptoms of pyrogenum? See, of course, what as the name suggests, relative tachycardia is very nice. Tachycardia, as the name suggests, pyrogenum is the remedy for that. Now, whenever you are prescribing pyrogenum, it is a remedy for septic fevers. Remember that, or latent pyogenic condition. Now, this is again very important. And the temperature rises very suddenly. That is pyrogenum, and of course, as doctor has told, relative tachycardia. 2-3 symptoms basically what you have to see in those conditions. Septic fevers, latent pyogenic condition is also very important indication. The temperature rises very suddenly and rapidly, and relative tachycardia. One symptom of pyrogenum that you must remember, there is throbbing in the muscles, in the vessels of the neck. That is pyrogenum. There is throbbing in the vessels of the neck and numbness of the hands and the arm. That is pyrogenum, with aching in all the limbs and all the bones. Sometimes you prescribe maybe eupytorum perfoletum or other remedies for bone fever, but actually the patient is pyrogenum. And in pyrogenum, like arnica, the bed feels too hard. The bed feels too hard. Like rustox, pyrogenum has symptoms soreness better by motion. So, bed feels too hard, numbness of the hands and arms, throbbing in the vessels of the neck, aching in all the bones and all the limbs, with tachycardia, increased temperature suddenly, septic fevers, and latent pyogenic condition. I hope that is sufficient for prescribing pyrogen. Okay, Adonis vernalis, you can low potencies, pus. Okay, so I think we are through with it, or some other questions are there. Somebody has joined me and my. So I think today it was only half an hour, but I just a lot of questions were there, so I could. But it is very nice, talking to you all, and the time passes very quickly, and it upgrades my knowledge also, and my rapid fire remembering of mathematics also increases when I talk to you. So thanks for all your suggestions, and I'll tell you something next time, Doctor. 1, 2, 3, 4, 5. So thank you so much. Thank you for joining. I have work, so I am leaving early today. I was going only to do half an hour, but still we stretched to 50 minutes. Thank you so much for joining, and nice learning with you all. Until we meet next time, thank you.